Hello, welcome to Chapter 5. We are going to talk about muscles and tendons today. So we're going to look at, again, deconstructing words. We're going to work on spelling and pronouncing. We're going to look at a lot of different disorders and structures, treatments, and goals to all of these. So let's start with muscles and tendons. We have 3 different types of muscle. We have cardiac muscle, skeletal muscle, and smooth muscle. Skeletal muscle is considered voluntary because we can control its movements. Cardiac and smooth muscle are involuntary. We cannot control how fast something moves through your digestive tract, smooth muscle. We can't control how fast or slow your heart beats, cardiac muscle. Skeletal muscle provides movement, allows you to ambulate around. Posture. There's muscles right now that are probably holding your head, unless you're laying down. Whenever you sit or stand, there's muscles that are holding you in that position. Body heat. Every time a muscle contracts, it generates heat. And then communication. It's going to send information into that nervous system about its position, about how fast or slow something is moving. It's going to provide a lot of different communication about everything that they're doing, really. So skeletal muscle, it is striated. It has that lined appearance. Skeletal muscle is made up of many different muscle fibers. These different fibers have these striations along them, and then we have this fascia around it. A bundle of muscle cells is called fibers. They are held together by fascia, which is a thick layer of connective tissue. These striations are light and dark proteins that are alternating, found within these muscle, and then fascia is Latin for band. Hypertrophy. Hyper means above or excess. That trophy is that nourishment. So hypertrophy is an increase in size, but not number. So hypertrophy means your muscles get larger, and the cells get larger, sorry, but we don't increase the number of cells. Atrophy, and that A means without nourishment, so that atrophy, your muscles cells are getting smaller or wasting away. Diminished volume of tissue, an organ, or a body part. Dystrophy. This is bad or without. That trophy means nourishment. So not enough nourishment, not enough nutrients to survive. So let's deconstruct these words. Contrast. Con means with or together, and tract means to draw. Peristalsis. Peri means around. Stalsis means constrict. than voluntary. Volunt means free will. That area means pertaining to. So voluntary means we can move our muscles on our own. We have that free will to do so. Active, causing action or change. In Latin, it means movement. Fascia is that sheet of fibrous connective tissue, but in Latin, it means band. Passive means not active, or in Latin, it means to endure. So there's a lot of different disorders of skeletal muscles here. Some of these you may have even experienced yourself, like soreness, maybe cramps, strains. Some of these other ones you've probably never heard of. So let's look at some of these. Fibromyalgia. Fibro is that root and combining form, which means fiber. My muscle. Algia means pain. These people usually have random muscle pains that have no other explanation. It's considered a diagnosis of exclusion, which means they've checked for every other possible thing before you get diagnosed with fibromyalgia. It's just random muscle pain that came from nowhere. They didn't exercise, do any strenuous work or anything. It's just random. Tendinitis. Tendon is that root word that means tendon. Itis is that inflammation. So it's that inflammation of a tendon. Rhabdomyolysis. Rhabdo is that combining form that's going to mean rod-shaped. We also have myo, another combining form, which means muscle. Then lysis is my suffix that means destruction. Rhabdomyolysis is destruction of skeletal muscle. It's usually from overuse, like way overuse. Tenosynovitis. Tenosynovitis. Teno is that root combining form that means tendon. Syno, another root word that means synovial membrane. Itis is that inflammation. Myopathy. Myo means muscle. Pathy means disease. Someone with myopathy usually has muscle pain, could have disease of the muscle. So there's different diagnostics that we can use again for muscle and tendon disorder. Blood tests. There's myoglobin found within muscle. This is what stores oxygen in muscle, but you can actually detect this in blood tests to see if muscles are being destroyed. Electromyography or an EMG, they can see if muscles are receiving information from the brain because their muscles are electrically excitable. So we can see if these muscles both work to contract and if the brain is sending them information or not. That MRI and CT, we can actually detect muscles on there, so we can see if there's muscle tears happening. Muscle biopsy is where we're taking that muscle tissue and we are looking at it to just see if there's any kind of disease to it. Genetic testing. There's a lot of different muscle disorders out there that are genetic, like muscular dystrophy. That's where those muscles specifically are not, they're losing their strength. And then myositis specific antibodies. This would have to do with an autoimmune condition that affects muscles specifically. Antibodies are what go around your system and kill off different pathogens, but if they're attacking your muscles specifically, it's autoimmune, so it's attacking your own cells. So different therapeutic methods. Rice. There's also price, add a P in front of it. But resting. You injure yourself, you shouldn't be out running. Shouldn't. You ice it to prevent further swelling. You compress it to get rid of current swelling, and then you elevate it above heart level again to reduce that swelling. P, if they had P in front of it, that just means to protect. So putting something over it that'll prevent further damage. Physical therapy, damage to muscles and joints, strengthening those specific areas through physical therapy can help prevent further problems down the road. People who have back pain, if you do core strengthening, strengthen their abdominal muscles or lower back muscles, it usually gets rid of their back pain. Not always, but sometimes, usually. There's different medications. Again, those NSAIDs that we mentioned earlier. Those are getting rid of that inflammation, or we mentioned in the skeletal system, or those NSAIDs. They're getting rid of some of that inflammation, which is getting rid of pain. Surgery. Of course, there's always surgical options, and then orthopedic appliances. Well, different braces that can be used. So muscles and tendons of the shoulder, girdle, trunk, and upper limb. So this pectoral girdle, it contains muscles that are attaching your arm to your trunk. 4 muscles specifically are going to originate from the scapula. Supraspinatus, infraspinatus, teres major, teres minor, and technically they're subscapular. So there's technically 5. Fuse to form large tendons. Well, a lot of those muscles that form that shoulder girdle have tendons that are making up that rotator cuff. They can insert most of them that are coming from the scapula go to the humerus. Subscapularis that I mentioned does not. Yeah, it does. It does go. So they all go to that humerus. So they're helping to hold that humerus in its socket. Overuse of that specific joint can cause tears. So let's look at some of the different muscles of the upper arm and shoulder girdle, vertebral column, and ribs. So that deltoid, that is the muscle that makes up the top of your shoulder. Pectoralis major is the main muscle of your chest. Latissimus dorsi is a very large muscle found in the back that actually comes up and attaches to that humerus. It's that muscle that allows you to take your arm and move it back behind you. We have our biceps brachii. That is the most superficial muscle of your arm. That common root Brachii in its combining form can either be brachii or brachio. Brachialis is found underneath biceps brachii. It's a separate muscle. And then there's brachioradialis that starts about halfway down that humerus and it attaches down to that radius. Bi and biceps means it has two heads. Bi means two, so it has two starts, two origins, as it's called. On the back of your arm, we have triceps brachii. Tri means it has three heads, origins. It has three places that it starts from, and it comes down to one end point. So we have muscles in our forearm that allow us specifically to supinate, hand up, pronate, hand down, flex your wrist. So from that anatomical position with your palm facing forwards, bend your fingers up towards your forearm, and extension, bend your fingers back behind you. We have specific groups of muscles that allow these different motions. We also have specific movements that allow you to move your wrist side to side. That's that medial movement and that lateral movement of the hand. So we've mentioned some of these already, some different tendon disorders. So that tendinitis, that inflammation of that tendon, that tennis elbow, we mentioned in that skeletal chapter. And it's because of muscles that work that forearm that allow you to flex and extend your wrist attached to your elbow. Tenosynovitis. It's a tendon sheath. So what it is like a bursa sac that wraps around that tendon that gets inflamed. Carpal tunnel syndrome on that thumb side of the hand, and then a ganglion cyst. It's a cyst that forms from those tendon sheaths. So let's break these words down. Ambulatory. Ambulat means walking. Ori is having the function of. So ambulatory is being able to walk around. Biceps. Bi means two. Ceps means head, two heads. Brachialis. Brachii means arm. Alis means pertaining to. Deltoid. Delt means triangle. Oid means resembling, so it's kind of got this triangular shape to it. Ulnar. Ulm, arm bone. R means pertaining to. Then we have triceps brachii. Tri means that three. Ceps, head. Brachii, of the arm. Pelvic girdle, thigh, leg, and foot. So let's start with the muscles of the glutes, but we have three different gluteal muscles. These gluteal muscles are named kind of for their size. Gluteus maximus means it's very large. Gluteus medius, About medium-sized, gluteus minimus is the smallest. Adduction for our adductor muscles means it's moving towards that midline. We have a group of muscles on the inside of our thigh that are known as the adductor muscles. Our quadricep muscles. Our quadriceps are made up of these four muscles. The quadriceps are on the front of the leg. We have rectus femoris, vastus lateralis, vastus medius, vastus intermedius. Rectus means straight. So this muscle is straight down the middle of the leg. Rectus femoris is the one quadricep that comes from the ilium. The other three, the vastus muscles, are coming from the femur. These four muscles come down and form the quadriceps tendon that turns into the patellar tendon where that kneecap, where that patella sits. The hamstrings are on the back of the leg. These all come from the ischium, that sit bones. And then they're going to attach or insert into the tibia and fibula. So we have our biceps femoris, semimembranosus, semitendinosus. The muscles of the lower leg, ankle, and foot, the calf muscles. So this is the back of your lower leg. We have our gastrocnemius. This muscle is the main muscle that you can see on the back of somebody's lower leg. And then soleus sits underneath it. Soleus means fish. It's kind of fish-shaped. Both of these muscles come together to form the Achilles tendon, which is attaching to the calcaneus, which is that heel bone. So let's look at these words. Abduct. Abduction. We have our noun. Our verb. Adduction. Abductor is our adjective. So to abduct means it's going away from its midline. Adduction means it's going towards midline. Dorsum or dorsal means behind. So physical medicine and rehabilitation. So a lot of times there's a lot of different people that are involved in rehabilitation types of processes. We have physiatrists, we have different medical specialists, occupational therapists. They're going to help more with activities that you do around home, like getting dressed, brushing your teeth, brushing your hair. Physical therapists are going to help with more strengthening of different muscle groups and help you get back to more daily activities. Rehabilitation psychologists, social workers, sometimes, or these people are helping to integrate people back into society after something happens. Speech therapists help with forming words, people who maybe after a stroke, who've lost that ability to talk, they may be able to retrain that brain to allow that to happen. And then a nutritionist is going to help with nutrition, making sure people are getting the right nutrients for their muscles and joints and everything to heal correctly. So rehabilitative medicine focuses on that function to maintain independence and a good quality of life. Restorative rehabilitation restores a function that has been lost. Maintenance rehabilitation strengthens and maintains a function that was lost. And it can also be involved in prevention of function loss and injury. So we have different ways that we monitor and measure different activities, these activities of daily living. A lot of these occupational therapists will do, some of them physical therapists will do as well. Eating, bathing, dressing, grooming, toileting, transferring. How much of that are you able to do on your own? And then we look at different instrumental activities that relate to daily living, like what all can you do independently? Can you manage money? Use a telephone, cook, drive, shopping, housework. These are all things that you need to be able to do, so they are instrumental activities of daily living. So we've got some different types of assistive devices out there. An assistive device is any kind of equipment that is used to maintain or promote function in someone with a disability, like a cane, a walker, even a shoe insert can help somebody. There's also computerized communication devices. People who are handicapped and who are not able to speak, they have different communication devices that can help talk for them. There's a lot of adaptive equipment out there these days that help people with their activities of daily living. Something that can help you eat. Even something that has a larger handle on it, like a fork or a spoon that has a larger handle that makes it easier to hold, can be an eating device. A raised toilet seat, somebody who can't sit down far enough to get back up. Handrails in the bath and shower. So there's also, you could put chairs into the bath or shower. Different ways that people can still maintain and keep up their daily lives. So let's break apart these words here. Assist means to aid or help. Assistive, we look at the suffix ive, is going to mean nature of, while assistant, ant is that suffix for pertaining to. Now this next group of words all has physio in front of it. Physio means body. So therapy is treatment of the body. Therapist, we break it down even further. We got this ist, which is going to mean specialist. And then we also have physiotherapeutic. So we add different endings. It's going to change that word. Curing. Amputations. Amputations can be caused by several different things. Peripheral vascular disease, usually develops from diabetes and or atherosclerosis, not peripheral vascular disease. They're not getting blood to that specific limb. It's usually the feet first. So they could end up losing their feet. They're not getting blood to that area. That tissue is going to die and it's going to necrose, die, and need to be removed. Wartime explosive devices can also cause people to lose arms and legs. So the objective of rehabilitation immediately after surgery is to help somebody to move on from what had happened. So below the knee, BKA is that abbreviation for it. So below the knee, promote healing of that stump, what's left. They work to strengthen the muscles above that amputation site. You also work to strengthen the arm muscles because you're going to need to use your arms more to ambulate and help with different activities. Prevent contractures, that muscle that contracts and stays contracted. Shrink stump to fit into a socket of a prosthesis. So replacing that foot with a prosthesis that's synthetic or fake. And then they also provide a lot of emotional, psychological, and family support because losing a foot can be very mentally damaging to somebody. So they need to have that emotional and psychological support to move on. So amputation. Ampute means to prune. And then ation is a process of. So to the process of pruning or removing something. Contracture. Contract means to pull together, where that your is a result of. Prosthesis, this specifically in Greek, is going to mean in addition. And then we have rehabilitation. Re means again. Habilitate means restore. And that ION is action or condition. So diagnostic procedures, therapeutic procedures, and pharmacology for disorders of muscles and tendons. So again, we can use different blood tests. Creatine kinase is another substance that is released by muscles. Erythrocyte sedimentation rate, something else we can use to determine muscle and tendon damage. That electromyography is that procedure where an electrode needle is inserted into a muscle to record that electrical activity. Again, that information being sent down from the brain. We use nerve conduction tests to monitor or measure the speed where motor or sensory nerves conduct impulses. Magnetic resonance imaging, MRI, shows these images of damage or diseases found within muscle. Ultrasonography or ultrasound. It's not just used to view a baby in a womb, in the uterus. We can actually use it to see tears and inflammation in a tendon. That muscle biopsy is removing a small piece of that muscle. That genetic testing, again, is because there's different mutations in genes that can cause different types of that muscular dystrophy I mentioned. myositis-specific antibodies. This can actually be used, polymyositis and dermatomyositis, two different autoimmune conditions that affect muscles. Again, we have our RICE, that rest, ice, compress, and elevate. P also can protect. These are used to treat muscle damage. Physical therapy and exercise prevents contracture of joints, so it helps keep those joints moving, and it assists in restoring muscle mass and strength. Medications can be used to treat different muscle diseases, that inflammation, even surgical treatments, such as tendon reconstruction, which sutures two ends of a torn tendon, and then orthopedic appliances like braces, walkers, help in that recovery process of muscle and tendon damage. So electromyography. So let's break this down. Electro is that combining form, meaning electricity. Myo is another combining form for muscle. Graphy is that suffix, means that process of recording. So electromyography is that recording of the electrical activity in a muscle. Inflammation. Ation, starting at the end this time, is that suffix that means the process. In is a prefix meaning in. Inflammation is that root word meaning flame. So inflammation is the reactions in the blood vessels and adjacent tissues in response to injury or abnormal stimulation. Ultrasonography. Graphy is the process of recording. Ultra is my prefix. It means beyond. And sono is my root word, combining vowel, meaning sound. So ultrasonography means that delineation of deep structures using sound waves. Some abbreviations. ESR, erythrocyte sedimentation rate. BX is biopsy. MSA, myosistitis, specific antigen. Then EMG is that electromyography. NSAIDs. What an NSAID actually does is it inhibits 2-cyclooxygenase, or COX, enzymes that are involved in producing inflammation. Paracetamol or acetaminophen is used over the counter as an analgesic and antipyretic for relief of minor aches and pains. Pyretic also means fever. Skeletal muscle relaxants. These are FDA approved for the spasticity or for muscular conditions like MS, multiple sclerosis. Anabolic steroids cause skeletal muscle hypertrophy, getting larger. So let's deconstruct these words. We have our root, contract, which means to pull together, and your means the result of. Immunosuppressive. My combining form immuno means immune response. Suppress is also another root word here. That means press under, and then we have our suffix of "ive," means nature of. Rhabdomyolitis, my combining form, rhabdo. My other combining form, myo, muscle, or rhabdo means rod-shaped, myo means muscle, then lysis means deconstruct. Myopathy has that myo combining form for muscle. Pathy means disease. Tenosynovitis or tenosynovitis. There we go. Teno is my first combining form. That means tendon. Synov is a root, meaning membrane. Itis means inflammation. That V is part of that synov. There we go. So let's deconstruct these words here. Analgesia. My prefix, an. Alges means sensation. IA means condition. Antipyretic. Anti, prefix meaning against. Pyrete is my root for fever. And then ic means pertaining to. Antipyretics are used to reduce fevers. Metabolite, my root. Metabol means change. Then ite means associated with. Metabolite associated with change. Anabolic, anabol means to rise up. Ic means pertaining to. So muscles are providing our posture, our movement. We've got different muscles that are attaching to bones throughout our body. There's a lot of different conditions of muscles, and there's a lot of different treatments for muscles. Thank you very much for listening, and have a wonderful day.